I have highlighted, if you see highlighted areas, pay attention. Because that means that you're gonna see it again in test form.
Does the test never change then?
No.
That's weird. Is it still like all the film too? Like how? Because we use films so
We don't-
readily.
yeah. Yeah, they don't even teach mounting anymore at LCCC. Film
I've
mounting,
shadowed a few
they
dentists.
discussed it,
Yeah.
discuss it, but they don't do it.
I've shadowed a few dentists, and I mean, like, they'll get X-rays sent over to them, and it's a little film, and they're like, "What the hell am I gonna do with this?" Like, thank you. We're just gonna take a new one.
Exactly. A, they don't have any place to store them. B, they don't, the little, those should never, the actual X-rays, films, radiographs should never leave the practice. They are part of that practice. They should send a copy. And if they duplicate it, they don't duplicate them one by one.
Yeah.
They usually put it out on a full mount, they put it out like a full mouth and duplicate it. So you get like a pano film
Yeah.
with a bunch of PAs on it.
Yeah. Wow.
Yeah. Okay, are we recording again?
Yes.
Oh,
We have
okay.
been.
Oh, okay.
That's okay.
I gotta watch my mouth. Okay. It is the absorption to the radiation, of radiation by the body that can pose a health hazard. The absorption is called exposure. Okay? An absorption, anytime there's an absorption, it's called an exposure. Exposure to the primary radiation occurs when the primary beam is partially absorbed by the body. Okay? Exposure to scatter radiation, a form of secondary radiation, occurs when tissue that has already been exposed to radiation deflects the beam to an adjacent tissue. It also occurs when X-rays are deflected within the tube head. If not for collimation in that PID, scatter radiation would be the result. Okay, do you understand the difference between primary radiation and scatter radiation?
Yes.
Leslie, you got it? Primary is what comes out the tube, and that's what we want. That's the desired beam. The primary beam is what we want. Scatter is the extra, okay? The extra radiation and you do have a certain amount of scatter radiation when you're taking an X-ray that comes from the PID, because it's gonna diverge. Once it gets to the end of that tube, of the PID, it's gonna diverge a little bit. So you're gonna have some absorption by the tissues. That's why we have lead apron, that's why we have the thyroid collar, to protect those tissues from scatter radiation. So scatter radiation is not desired, primary radiation is desired. Primary radiation is unavoidable because absorption of the X-rays by the target is the basis for the formation of the meaningful image on the film. That's what we're trying to accomplish by doing this procedure to start with. And it can be minimized by, can you read that?
What?
By giving good technique.
By achieving good technique, okay? Scatter radiation travels in all directions and is weaker than the primary radiation. It's controlled by proper shielding in the tube head, collimation, and by correct technique, okay? And those two principles are on the test, okay? Primary radiation exposure can be reduced by achieving correct technique. Scatter radiation can be avoided by, controlled by proper shielding in the tube head and by correct technique. Proper shielding and correct technique. Okay, next. Okay, you see that big green star?
Yes.
I want all that memorized. Okay. Radiation damage to the body. It occurs when absorption of radiation may or may not cause damage. It depends on certain factors. The quality and quantity of the radiation and the types of cells that are exposed. Rapidly dividing cells, such as found in children, are most sensitive to radiation. Since the effects of radiation may be cumulative, what does that mean?
Like they add upon itself.
It adds on itself, okay. So the effects of radiation may be cumulative. We must clearly justify exposing children to radiation. They have a long life ahead of them. They've got a lot of radiation to gather, okay? The effects of one exposure may be added to the effects of another, so that the multiple exposures could damage the body. Okay, the tissues of the body that are especially sensitive to radiation from dental x-rays are rapidly dividing cells. Bone marrow, red and white blood cells, lymphoid tissue, thyroid tissue, and mucous membranes. Okay, questions about that? All of those are examples of rapidly dividing cells, as well as with children and pregnant patients. Other parts of the body that are especially sensitive to radiation exposure, but these should not be affected by taking dental radiographs because it's away from the area that you're exposing, plus you're going to be using the lead apron and the thyroid collar, okay? And these include the cells of an embryo in a pregnant woman, especially in the first trimester. Why the first trimester?
Rapidly dividing cells.
Rapidly dividing cells, that's when the baby's making a baby, okay? You make the baby in the first 3 months, the first trimester. From that point on, from the second trimester on, the baby's just maturing his organs that he's already developed, and he's also putting on weight, okay? So that's his job in the second and third trimester. Second trimester is to mature the organs, and then the third trimester is to put on weight. And the lungs are developed to their final stages in the third trimester. Also, an area is the gonadal tissue, especially in males. Why would males, the gonadal, you know what gonadal tissue is, right?
Gonads.
Gonads are the testes and ovaries, testes in male, ovaries in females. Why would males be more susceptible?
Is it because they're constantly generating their?
It's an anatomical thing. Males' gonadal tissue is on the outside of the body. Females, it's on the inside of the body. So that there's less tissue, if you will, between the testes and the radiation than there is from the ovaries, and there's more tissue between the ovaries and the radiation. Does that make sense?
Mm-hmm.
Okay, health risks from properly administered dental radiographs are minimal because the x-rays are focused in a very small, isolated area and the exposure time is brief. Even though the risk is small, special knowledge is required to take x-rays safely. And because x-rays taken improperly can cause serious harm to the human body, it is important to follow the correct procedures. Okay? Each time you are taking an x-ray on someone, you are exposing them to a dose of radiation, and you should take that seriously, okay? And you want to get the best result with the least amount of radiation, okay? All right, let's move on. But that is an important area, and I want you to especially pay attention to that asterisk area. Okay, radiation safety, ALARA is an acronym. Okay, let's write ALARA on the board here. Does the black show up better, you think?
Yeah.
Probably.
Okay, ALARA. A is as, L,
Low.
yeah, okay. Low, A as,
Achieve or reasonably achievable.
reasonably achievable. Okay, as low as reasonably achievable. You need to memorize that. You'll see it a lot. You need to understand it. Okay? That means I'm going to expose Talon to as little radiation as possible to achieve the result that I need, to get the x-ray that the doctor needs for diagnosis. I'm going to use as low radiation as possible. That means I'm going to have good technique so that I don't have to take it again. Okay? I'm going to make sure all of my controls are where they need to be. Okay? We're going to talk about it later, but an incisor needs less radiation than a molar. They're smaller. Okay? So that would be something that I could control. Right? Okay. As low as reasonably achievable. Okay. Next is collimation. No, that was next for me, not you. You lost us.
It's that's 6. Yeah. Right.
Okay.
No, just kidding.
There we go. Okay.
Student
Oops. Yeah, let's talk about these terms because this key terminology, because it's very, very important. Okay, so we have a LARA. Now we're gonna have a collimator. Collimator. C-O-L-L-I-M-A-T-O-R. Okay, read what it says about a collimator up there.
A device that helps eliminate peripheral radiation.
Okay, another way to say that is it
Focuses the beam.
focuses the beam. Okay, next is a dosimeter. Read that for me, Leslie.
A device that measures cumulative radiation exposure.
All of this just reminds me of Chernobyl.
I wonder why, because they're both having to do with radiation.
Very same amounts, obviously.
Kilovolt. Is what?
A unit of electrical energy equal to 1,000 volts.
A unit of energy.
Equal to 1,000 volts.
Okay, it's also no, it's a large V and a small K. Okay. It's also abbreviated like this.
Oh my God.
KVs. It wasn't as bad as it sounded. Okay, and a milliampere. Somebody read that for me.
A 1,000th of an ampere. the unit of measure of quantity of radiation.
Quantity?
Yep.
Okay, it's quantity of radiation, and it is abbreviated as an MA. Okay? And what's that last one say? REM. Okay. REM. What is a REM?
Biological dose.
A biological dose. What in the world does that mean? A biological dose. We're going to find out what the maximum allowed biological dose is. So that's gonna come in, that's gonna come in play again, okay? So the X-ray equipment itself includes technology that helps to make safe X-rays. The area of the machine where the X-rays are produced is shielded in lead. Remember I told you when we were back there looking at the machine that inside that tube head there was an area that was shielded in lead. That whole thing inside is shielded in lead, okay? And it prevents the X-rays from the radiation from escaping the machine except through the small opening through the primary beam is allowed to flow. Okay, next. Next page.
Oh my goodness, why does it keep doing that to me?
Operator error.
Literally.
Mm-hmm.
Okay.
Oh,
Oobies.
rubies. Back. Over.
Zoom, zoom, zoom.
Zoom.
There we go.
Okay, a small hole through which the primary beam passes is covered with a special aluminum filter. We talked about the aluminum filter. The filter removes the low energy X-rays that do not improve the quality of the image, but that could be harmful to the patient. Federal regulations require that for machines rated up to 70 kilovolts, okay, kV, the filter must be 1.5 millimeters thick. Up to 70 kV. If the rating is higher, that means increase or higher, okay? An arrow up. Increase of 70 kV, it must be 2.5 millimeters thick. Other filters may be added, but this is required. This is a picture right here of the aluminum filter, and it fits right in here between the PID and the head. Okay, right in here. This is all the way around, so it's a circular deal right in here. Looks kind of like a washer.
Yeah.
This is for filtration, aluminum filter. Spelling. Aluminum filter. And that's the requirements. Okay, next we have the PID. PID is the positioning indicating device, and it allows the operator to line up the beam in exactly the correct location, reducing the patient's exposure to the radiation. In other words, instead of going up to Talon and taking an x-ray like this, we're gonna have it close to the face. We can eliminate extra areas. What's this mark that? This also helps to ensure that the beam is not aimed at specifically sensitive areas such as the thyroid glands in the neck. Everybody knows where your thyroid is? It's that butterfly looking tissue right here in your throat. Okay. So the PID is the positioning indicator device. Okay? Next, we're going to have a collimator. Okay, and the collimator reduces, line down, arrow down means reduces. Scatter radiation. And it limits the size of the primary beam. Another way to say that is it focuses the beam. Okay? Okay. Is that all of our terms? Okay, next page. Control settings. Control settings of the control panel. I said that's where you control your KV and your MA, remember, back in the other room? So, the MA setting controls the quantity, how many of the x-rays are produced during an exposure. The word you need to associate with MA is quantity, okay? MA equals quantity. That needs to be cemented in your brain, okay? Because the KV is different. The KV regulates the wavelength. Penetrating power. Or quality. the word that you need to associate with KV, is quality. If you get these two mixed up, you're screwed on the test. Just as simple as it can be.
So what you're saying is at the top of the test, first thing, just write it down really quick.
Yeah, I'm gonna leave the board up for
Oh.
your test.
Well,
I said I do everything I can to help you.
I really
It's not
appreciate
cheating,
that.
it's
It's not
forgetting and using your resources.
But that doesn't mean you need to relax and chill out, cause Barbara might come in and erase it while I'm gone. I'm only here on Saturdays now. Before I was here all the time and somebody come in here, I go, don't erase my board. But I'm not here to protect it, so it could happen. So don't count on that, but I do generally leave it all up. And it looks different every single time I do it. A lot of times the students will take picture of it so that they can review it at home. And, you know, what did she say? I don't understand that KV deal. What did she say about that? And then it's up here. But this is the words, these are the words I want you to associate. Okay, those are quantity and quality. That'll may become a little more clear later. Are we getting this on the board on the? Here, she said something about we might have to move it. Okay. The time control is another factor here. What do you think that controls?
The length of exposure.
Exactly. Most of the time, these things are preset. So the time control, the key word here would be time. Okay? All right. And does anybody need a break?
Nope.
Okay.
Do you?
I might.
You're the one doing all the talking.
I might. Yeah, let's take a little quick break. You want to pause our recording so we don't
Sorry, I'm like
get our
really focusing.
chit chat?